Alright, this is Brian Wormers recording a lecture on cancer development for medical surgical nursing at the University of Sioux Falls. So within this, we're just going to talk about kind of like a patho review. This is cancer development and talking about some of the behaviors that might help reduce some of the risk factors for cancer. We'll talk about some cancer types, and then we'll talk about grading and staging. So do your pathophysiology review. So tied with that, and know what those cancer cells are. Know those terms about benign versus malignant. So malignant is usually faster growing and more differentiated from the original parent cells than the benign are. And malignant tend to cause more complications with the fact that it does tend to metastasize more and go out to secondary areas. Classification, so 1 through 4, it depends on how closely they resemble that normal cells. 1 is closer to the parent cells, and 4 is vastly different. And so the more different it is, usually the more dangerous it is. We can stage it, with the tumor we can stage it. Are there any node involvements, and is there metastasis with this? So you'll kind of see that TNM scale used quite a bit, just so you know what it is. Carcinogenesis is influenced by, surprisingly enough, exposure to carcinogens. And so some of these things can be tobacco, alcohol, radiation, irritation, dietary factors, things that they've been exposed to. Genetic predisposition and immune function. So cancer risk is increased amongst those that are immune suppressed, so just be aware of that. So prevention of cancer, really try to avoid those carcinogens. So we talked about all those different things before. Trying to prevent skin cancer with minimal exposure to UV light. Watch your dietary, so increase your fiber, increase your fluids, decrease your red meat, animal fat, especially if you like it charbroiled. Practice healthy sexual practices. Vaccines for HPV are out, and that has been shown to decrease cancer. And then removal of at-risk tissue. So if we see skins or polyps that are suspicious looking, we might remove those before they turn cancerous. Secondary prevention, so screenings, so trying to catch them when it's really, really early. And so doing mammography for women, annual breast exams, and actually guys are actually supposed to do this as well. Colonoscopy, looking for DRE for men, BRCA1 for breast cancer, and looking for any colorectal cancer screening. So some of the things that we might see on a patient or ask them if they've got a cancer or that might point to cancer would be caution. Changes in bowel or bladder habits, a sore that doesn't heal, unusual bleeding or discharge, thickening or lump in the breast or any other part of the body, indigestion or difficulty swallowing, obvious change in a wart or mole, or nagging cough and hoarseness. So that's just a quick overview talking about cancer development and some of the things we look for. The other slide will have more information about care of the patient with cancer.